Okay, I'll just introduce the whole session. So, as you all know, I'm Dr. Tahir. Put on my video, and anybody who wants to share their video are welcome to do so. Anybody who doesn't can stay as you are. If anybody wants to even keep their name hidden, you can do that as well. But please let me know who you are. Okay. So this is, I think, my 75th session uh, since I started doing these revisions. And my name is Dr. Tahir, as you all know. And today we are about to do a history taking session. I can see that most of you are Nigerians here. There is one, I think, person from Uganda, Dr. Gerald, and we might have a few other people. I don't know. I think I met most of you, so welcome. Okay. Before I start, we are doing a history session, and when I start sharing the screen, Dr. Gerald has agreed to be the candidate, and Dr. Shoppy is going to be the timekeeper for us. And after the history session is over, I will request at least 2 or 3 of you to give feedback to Dr. Gerald. Good feedback includes appreciation and constructive criticism, so remember that. All right, let's start. So time starts now. Dr. Shoppy, are you happy? Dr. Shoppy, are you happy to start the timer?
Yes, sorry, I was on mute. Yeah, I'll start the timer now.
There you go. Okay, 4 minutes starting now. And for now, I will pause the recording while the time is going down by 4 minutes.
Shall I start?
I don't know, Dr. Tahir.
Audio is muted. Yes, please start.
Okay.
Okay. Hello, am I talking to Janet Mamtu Jr.?
Yes, I'm Janet. Hello.
Hi, hello. My name is Gerald. I'm one of the doctors here. Pleased to meet you. So I'm here to talk to you. I understand you just came into the area recently.
Sorry, when you say one of the doctors, who are you?
So I'm one of the pediatric registrars here in this
Okay.
hospital. Yeah.
Okay. Thank you. Hello, Dr.
Yeah.
Jain.
Hi. So understand you've been referred by the GP because you're new in the area. So I just need to talk to you and gather some information about Junior. So
Sure.
we can come up with a management plan. Is that okay?
Okay.
Yeah, right. So could you tell me any main concerns today, any issues?
So I believe that the doctor has already written, and we are aware about the fact that he has Down syndrome.
Yes.
And you can see him. We have quite a few concerns actually.
Yeah.
He has been diagnosed with a heart problem, and
Okay.
as you can see, he's wearing. Sorry, whoever is not muted, please mute yourself, except Gerald. Yeah, I think now everybody is muted. Okay, carry on. So yeah, so so we have had this diagnosis of the holes in his heart.
Yeah. Yeah.
Actually, we used to stay in Bangladesh.
Okay.
As a part of my job, I was working with the government there. And
Yes.
unfortunately, we were unable to get him operated, but he was stable. So they said, you can get it done a little later. So we've not had the
Okay.
surgery done.
All right.
He also has a treatment with thyroid replacement hormones. So he has been diagnosed with a low thyroid. So
Okay.
when we came 3 weeks ago from Bangladesh, we have brought medicines for about a month or month and a half. So we are kind of running out of that. Also,
Okay.
I'm concerned about the fact that he has a problem of not pooing properly. So he's constipated and he
Okay. I see.
keeps suffering from nose and throat infections very often. So we are worried about that as well.
Okay. I see.
These are
Fine.
some of the concerns we have. And of course, we also have a problem of, him putting on too much weight. And
Okay.
sorry, darling. So she's just telling Junior.
Oh
But
dear. Yeah.
he's putting on a lot of weight, so we have quite a few problems actually.
Okay. All right. Fine. Thanks for that. That's quite helpful. So there's quite a number of issues here, and I'd just like to explore a bit more, if that's okay. So at the moment, is he unwell in himself? Any new issues? Any sort of like fever, rash?
Um, a week ago, we treated him with amoxicillin by the GP because he was having this sore throat and chestiness, and
Okay.
he's just finished his antibiotics actually day before yesterday. Uh,
Okay.
so currently he's okay. He's not having any temperatures.
All right. Thank you. How's his appetite otherwise?
He eats well.
Okay.
He is quite the eater actually.
Okay. And in terms of activity, has anything changed with his activity?
No, he's active.
Okay.
Don't get me wrong, but he is obviously, although he is, 7 years old, he is got learning difficulties, and so his behavior is more like like a 4 or 5 year old. So he does suffer from mild to moderate learning difficulties, but he's
Okay.
active. He's active.
All right. So just to talk a bit about the weight, you did mention that he has quite an amount of weight. Is that a recent development, or has he always been on the
Uh,
big side?
I would say since a couple of years actually, because you see, even though he's active, he's not as active as other children are,
Okay.
and he is eating quite a bit. So yeah,
Okay. And in terms of the centile, do you know what centile he's on?
no, I don't know what the word means. Sorry, what is?
Okay, right, fine. That's completely fine. I'll review that later. Does he sleep okay? Any problem sleeping, snoring, or anything like that?
So he does snore,
Yeah.
uh, but that's the doctors in Bangladesh told me that his tonsils and all were okay, and he did not need any surgery. But they said
Okay.
that children with Down syndrome can have problems with snoring. But we have
I
not
see.
tested it further.
All right. Has he got any lumps and bumps anywhere on his body?
I don't know what that means, doctor.
Okay. Any swellings on his neck or
No,
anywhere?
no.
Okay. All right. Fine. So in terms of so you've mentioned quite a few issues that he's got. Has he ever been admitted to hospital?
Oh yeah, he's been admitted 3 or 4 times actually, and this was all
Okay.
for the infections that he had. It was all chest
Okay.
infections, basically.
Chest infections. Okay. And what was done for him? How long did he stay?
Do you want me to tell you for each one of them? I don't have all that, but I can tell you the last
That's
admission.
completely fine. The last one.
The last admission was about a year ago. It was a 2 night admission. They basically wanted to give him some oxygen and all, and then he seemed to recover, and he was sent home on oral antibiotics.
Okay, well, fine, thank you. Has he undergone any operations whatsoever?
Yes, he had one surgery. I think he had the middle ear infection, so they had put some plastic tubes inside his ears, but that's about
Okay,
it.
all right, fine. And what treatment is he under? Any team of doctors looking after him? Given that you mentioned quite a few issues, and then you said
So
he's seen by the ear doctors.
um, I know how medical care works in the UK. It's
Yeah,
not as well organized in Bangladesh, but
I see.
even then, I mean, he had his child doctor, he had a heart doctor.
Yeah,
He also used to go to the opticians quite often because he's got thick eyeglasses.
okay,
But there are some and the some problems that have been just managed by the pediatrician. So, for example, his thyroid was managed by his pediatrician. His chest infections are managed by a pediatrician. Uh,
okay,
we have no access to a dietitian over there. We'd
okay,
love to, but we don't. And
okay,
he had this learning difficulties. There was a team that included a uh, occupational therapist and there was a developmental pediatrician who saw him only once when he was 2 years old, but there has been no follow-up with them afterwards.
Okay. And in terms of investigations, what tests has he undergone in terms of either
So
blood
he
tests or
obviously had his
imaging?
obviously he had his diagnosis because of the test. So there are too many tests to talk about.
Okay.
But
All right, fine.
he had the heart diagnosis, he had the thyroid diagnosis,
Okay.
had the yeah, he had so many X-rays of the chest for his chest
Okay.
problems.
Right. Could you just tell me a list of medications that he's taking at the moment, if
So
that's
he
okay? You
takes
told me about,
yeah. He takes about half a tablet of the thyroid replacement.
yeah.
Not too sure what the strength of that medicine is. He's also been started on Movicol by the GP 3 weeks ago. He takes
Okay.
one sachet in the morning and one in the evening.
Okay.
And uh, nothing else, sorry. No other medicines. That's why we are here today to
All
get a
right.
plan.
And in terms of the constipation, how are things? Is he having regular boils now?
No, there's not much of an improvement yet.
So it's not helping. Okay. Fine. I'll just ask a bit more questions. Does he have any hearing problems?
Yes, he had those plastic tubes inserted and all. After that, he's better. Uh,
Okay.
the ENT team in Bangladesh had assessed him about 6 months ago, and they felt that he won't need any surgery further. Uh, so they were planning to see him again after 6 months, but in between that time, we have moved
You
back to
moved. Okay, I see.
moved to the UK.
Fine. Does he have any swelling in his neck?
Sorry, you did ask before, didn't you?
Yeah, I did. Fine. How about in terms of, so you said he has a chest infection, but any breathing difficulties at the moment?
Yeah, he's frequently very snotty and has a cough and all. So he finds it
Okay.
difficult to breathe at that time. But there's nothing, when he's all right, he's all right.
Okay. And how is he managing in terms of exercise? Is he coping with exercise? Does he get tired easily?
What do you mean by exercise? Do you mean like in a gym?
Like routine activities, playing with the other children?
Okay. Just pause. I've got a call coming, so just pause, please. Okay. Yeah, please carry on. Shopee, please add 25-30 seconds more. Okay. Yeah, carry on, Gerald.
Yes. Does he drink lots of water, like drinking lots of water and peeing a lot? Have you noticed any of that?
No, no such problem.
Okay. Any tummy ache? You did say he has constipation, but does he have any tummy ache at
Yeah,
all?
he does have tummy ache from time to time. You're right, but
Okay.
nothing out of the way.
Okay. Fine. Any salt craving?
Um, no.
You have noticed that. Okay. Does he have any birthmarks or rashes on his skin?
No,
Okay. Any joint swelling?
no.
Okay. Could you please tell me about the pregnancy? Any problems in pregnancy at all?
Yeah, sure. He was born at full term, and
Yeah.
it was a cesarean section. But he
Okay.
cried soon after birth. I don't remember the exact time, but they told me that he cried normally. He
Okay.
did have a bit of jaundice, and he was under the lights for a few days,
Okay.
um, but no other problems.
All right. Fine. And did you undergo any screening and pregnancy, ultrasound scan or blood
Yes, so
tests?
we knew that he had Down syndrome pretty much before birth, and so we decided to go ahead with the pregnancy.
Okay. Fine. And did you, just a bit of a sensitive question, use any alcohol, drugs, or cigarettes in pregnancy?
Did I use all of them? No, nothing.
Okay, fine. So you said he was born at did he need any help whatsoever when he was born?
No, as I said, he cried soon after birth. Afterwards, he had jaundice. That's it.
Okay. And I know, yes, so you told me you came from Bangladesh. I was wondering if they did any screening, the newborn screening tests in the
Yes, they
blood.
did. Yes, they did.
Okay.
They
Yeah.
did the examination. I don't know what you call it, but they did the general examination. That's it. That's what I mean.
Okay. Okay. Fine. And how about bloods? Did they do any genetic bloods?
So he had his genetic diagnosis when he was about 4 months of age.
Okay.
Because they didn't have access to doing it at birth, but they got the blood sent to some other country and they got the results, and that confirmed that he had 3 sets of the 21st number chromosome, and so they
Okay.
confirmed the diagnosis of Downs.
All right. And do you remember roughly? I know it's a long time ago, but how many days of life, or how many hours did he open his? Did he pass the first pool, the black pool, the one that's called meconium?
At birth, he passed it at birth.
Okay, fine. In terms of his development, how is he acquiring skills? Have you noticed any delays in acquiring skills? Things like walking. What is he able to do in terms
Yeah,
of walking?
I did mention to you that he's performing at the age of around 4 years, 4 to 5 years. So he has
Okay.
delay in everything. He's delayed in all the milestones by about
Okay.
20 to 30%, 40%. Yeah.
That's your
Okay. I see.
Okay. So 9 minutes up, you've got 4 minutes left. Is that right, Shoppy?
No, that was the 4 minutes. So that's the four. That's the
Why didn't you give him a reply? Why didn't you give him a reminder at 9 minutes?
Yeah, I did. Sorry, I don't know. Maybe my signal went out.
Nobody heard it.
Oh, sorry.
Okay, we'll give Gerald 2 more minutes.
Oh,
Gerald, please
sorry.
time him for 2 more minutes. Gerald, please conclude everything in the next 2 minutes.
Okay, fine. Thank you for that. Yeah. So could you kindly tell me a bit about your family?
So we have just him,
Yeah.
and my partner and I, we both live here. We
Yes.
shifted here about 3 weeks ago, as I've said. We have
Okay.
a place of our own, and my partner and I, we are doing well between ourselves.
Okay. And so financially, you don't have any concerns with that here.
No.
Is there anyone else in the family that has a diagnosis of Down syndrome, if I may ask?
What do you mean, doctor?
Is there any family history of Down syndrome?
No.
Okay. And this is a sensitive question, but are you and your husband related by blood?
He's not my husband.
Okay. Your partner, are you related by
No.
blood?
No.
Okay. All right. Fine. So in terms of school, have you found a school for him? And
Yes,
what's
he started going to a special school.
okay, special school. So he's got support in the school.
Yes.
Okay. Fine. Have you got any social services involvement?
No.
And I know it's been quite a journey, but I'd just like to know the psychological impact of all this on you as a family and on him.
So what? Sorry, I didn't understand the question. Again, please.
Yeah. So how is his condition affecting him and you as a family
No, he's
in
just a
terms of yeah?
child. He's just a 4-year-old child in his mind.
Okay. I
I
see.
don't know what you mean, doctor.
All right. That's okay. Have you had
That's
any?
the time.
Okay, time up. Okay,
Okay.
we'll stop it. Okay, I want you to come online, Dr. Gerald. I would like to see you, if you can.
No, I'm not able to open
Why is
the
that?
camera. Sorry, I'm not able to open the camera.
All right, it's fine. Okay, so tell me, in your own words, how do you think that went?
A bit challenging, I would say, gathering the information. There's multiple issues to touch here and there. Yeah.
Okay. So you feel that your main issue was trying to ask about everything within the 13 minutes.
Within 30 minutes.
Okay. But what do you think went well?
So I tried to get the information that's relevant to the diagnosis at hand, which is Down syndrome.
Okay. Right. I will request a few of you to please provide feedback to your colleague. Whoever wants to go first, please raise your hand, and then I will let you take over this audio. Come on. We shouldn't waste time. We've already wasted some time. So let's have some people come in and give some feedback to Dr. Gerald. Who goes first?
Okay, thank you.
Go
Thank
ahead.
you, Dr. Gerald, for the history taking and for volunteering. You really try because there are multiple issues surrounding this child. But in view of the history of the constipation and the weight gain, which the mom complained of, so I was wondering whether I think maybe it was necessary to ask when she had a last review of the drugs, the thyroid drugs that she mentioned as in terms of the dosage, because I felt it would have thrown more light into the history, like the drug review, the last drug reviews based on the weight, since the child was growing. So I felt I should have asked.
Thank you.
Okay.
Thank you. Thank you for that.
Anybody else? One more person will be fine.
Thank you,
Yes.
Gerald, for your presentation. That was a good attempt. He obviously had a lot of problems. I think you could have gotten more out of the history and been able to get more out of your limited time if you had strategically looked at the individual problems he had and just asked focused questions around them. For instance, when he came in, the mom in the scenario pointed out some things. Early on, she said his development was delayed. Early on, she pointed out that he had some thyroid issues. He had some issues with his growth. They had the respiratory infections. So I feel perhaps we would have taken each of those problems and then asked some focused questions around each in order to find out for each problem he had, where is he right now? And I think with that, you would have been able to get more information within the limited time. But altogether, it was a valiant effort. Well done.
Thank you so much. I appreciate it. Thanks for the feedback.
Okay. Right. So let's go through the 9 minutes with the examiner now. And after that, we will have a full discussion. Okay. So your timekeeper, Dr. Shoppy, are you ready to time him for 9 minutes? Time us actually.
Yes, I'm ready.
Thank you. Okay, so Gerald, your 9 minutes begin now. I'm the examiner and you can do your short summary and then we'll talk about the issues that we need to discuss.
Okay, so today I've taken history from Janet, who's mom to Junior, 7 years of age, who's got a background of Down syndrome. He's got delayed development. Mom says he's actually at age of about 4 years. He's got visual problems, so he's got glasses. He's got a congenital cardiac problem that's not operated. He's got thyroid disease. He's got constipation, and for this, he's on levothyroxine and Movicol. He has a history of frequent ear infections. He's been seen by ENT and has had grommets inserted. With regards to perinatal history, he was diagnosed antenatally. There was suspicion. However, he was diagnosed with Down syndrome with genetic studies at 4 months of age. In the social history, the family recently moved from Bangladesh. He's currently in a special needs school.
Thank you. Yeah, that's good. I probably think you missed his snoring problem. So he does have the snoring problem.
Yes, snoring, yes.
I don't remember. Did you ask about allergies
No, I didn't.
and immunizations?
No, I didn't.
Okay. Fine. Okay. So I can tell you those things. So he's got allergies to he's got allergy to peanuts. He had nearly died when he had peanuts. I don't know why mom forgot to tell you, but he had allergy to peanuts. And he has been immunized with whatever is available in Bangladesh. His schedule is complete, but there is a plan to give him some additional vaccines here. Can you tell me, since we are on vaccines, what additional vaccines would need to be given to him if we found that he hasn't received any of the special vaccines that children with Down syndrome need to take, if there are any?
Yeah, so the pneumococcal and meningococcal vaccines, I'll just double check that he's taken pneumococcal, meningococcal, and Haemophilus
So I can tell
influenza.
confidently that he has not taken the pneumococcal vaccine. And which meningococcal vaccine were you referring to?
So the pneumococcal conjugate vaccine.
Yeah, that's a pneumococcal one. Conjugate vaccine, did you say? Okay.
Yes, conjugate.
Which meningococcal are you referring to?
So meningococcal B vaccine.
Okay.
Yep.
All right. And in terms of any other vaccines, can you think of anything more?
So the seasonal vaccines like the flu jab.
Sorry, which one again?
The seasonal vaccines like flu.
Flu vaccine.
Yeah.
That's okay. Right. So fine. We go back to your overall presentation. So how do you plan to manage him?
So in the management, I would want to first examine him, and then I would want to involve multidisciplinary team in his management. This would involve a general pediatrician, a developmental pediatrician. He's got thyroid problems, so an pediatric endocrinologist. I would need to involve a geneticist, ophthalmologist, cardiologist, GI specialist or gastroenterologist, ENT and audiology. Yes, plus an allergy specialist, since he's from the history, I think he seems to have had anaphylaxis at some point, so evaluation for allergies. I would want to involve the other supportive teams, such as physiotherapy, occupational therapy, speech and language therapy, psychological support, school liaison, as well as provide information about support groups to them.
Okay.
Including a dietitian as well, given he's had a bit of weight issues.
Okay. So in your opinion, we need a lot of people. Is there anything that we need to do urgently for him?
So urgently, I would want to review his weight, review his medications, the doses of the medications if they're appropriate, particularly if it's gained quite a bit of weight.
So how will you review the medications? Can you tell me one by one?
Yeah, so I'd want to see what medications he's taking.
I have already, yes, I think.
Yeah, which is levothyroxine and Movicol, but I would want to see the doses, what doses he's taking.
So how will you see the dose of levothyroxine? I mean, how will you see whether it is enough?
So I'll look up the information of the needs for his weight in the
So
BNA
I can tell you
direction.
his weight is above the 98th centile, and he is currently on 25 micrograms of L-thyroxine.
I'll check up this information. I don't have this information off of my fingers now.
So what does the dose of thyroxine depend on? Does it depend on height? Does it depend on weight? What does it
I
depend?
think it depends on the. I would want to do thyroid function tests.
So yeah,
Thyroid
so that's the
function
answer.
test just
That's the
to see the
answer I
control.
want
Yeah.
you. Don't say I don't know his weight and I've got to check on beta. That's not the correct answer.
Yeah.
Okay. So you want to see his thyroid function test. And what are you aiming
Yes.
for? What is euthyroid state?
So euthyroid state is if they have T3 and free T3 and free T4 in the normal range, as well as TSH.
What is a TSH you would be happy with?
In terms of the numbers, I don't have the numbers of
Okay.
my hands.
Okay. So that would be your thyroid. What about how would you assess the adequacy of Movicol?
And so the adequacy of Movicol, take a bit of more history into his bowels, using the Bristol stool chart, and then ask how many sachets he's taking per day.
He's taking 2 sachets of pediatric Movicol every day.
Okay, so I have
His stools are still only once every 5 or 6 days. He has a little bit of overflow diarrhea, and he has on examination he has some distension. So confirming that the two sachets of Movicol are definitely not doing much for him, and his stools are type 1 or 2.
Yeah, so this simply means he's impacted, and I would want to prescribe a disimpaction regime for him.
Okay, so can you tell me what that regime is?
So the disimpaction regime, again, I'm not too sure how many sachets there would be, but I would get guidance, for example, from Eric Disinfaction guidance, to see how much he would take.
Just on a ballpark view, 1 sachet twice a day, does that seem to be enough?
No, certainly not. So 1 sachet twice a day is certainly not enough. So for his age, for 7 years of age, he may need, I'd say probably 4 to 6 sachets
Per day?
Yes.
Okay. All right.
Yeah, but I'll double check this information.
Okay. So that's fine. Okay. How would you said ophthalmologist. Why do you want to send him to an ophthalmologist?
Yes.
No problem. We'll continue for learning purpose.
Yeah, so he wears glasses. I'm just not too sure what. Probably would have asked a bit more. What was the problem that led to him wearing glasses?
Okay.
Yeah.
Okay. So the most important thing that you completely forgot is cardiology.
Yeah, I did mention cardiologist.
Did you? Okay, fine. So
Yes,
how
I
would you,
did.
okay. So what is your plan with the cardiologist? My apology if you mentioned.
Yes, I did. So I would want to review if he's had any investigations, such as cardiac echo, ECG, X-ray, and what the findings of those were.
Okay.
Yeah.
So you've done everything and it's confirmed that he's got AVSD. So what's your plan?
So if he's got AVSD, I want to perform a cardiovascular examination, including
After
his
doing
blood.
echo and everything, you're going to examine the child. Why? I thought you examined him before, isn't it?
Yeah. So if he's got AVSD,
You got the confirmation he's got AVSD. So I'm asking you, what's your plan? So you're going to again go and examine him. Why?
If he's got AVSD, depends on whether it's it's causing cardiovascular compromise. So he would need to be assessed for whether this would be managed medically or surgically.
Okay. All right. Okay. So that's fine. Thank you very much for your time. Okay. Let's go back to our group and ask everybody. Okay. So how do you think Gerald did on his discussion? Can I ask some new people to contribute? So Dr. Hina, if you're able to talk. Dr. Hina, are you there? Yes.
Yes,
Go ahead.
yes, I'm there.
Go ahead.
Sorry. I think he did well in his discussion. He was clear on what team to be involved. And though he needed a bit of prompting as to how the main issues, I didn't listen to the whole of the history, but I think overall he did well in the discussion.
Thank you. Dr. Shoppy, you haven't come in, so I would like you to give some feedback to Gerald. You can even talk about the history bit.
Okay. So yeah, well done, Dr. Jola. I think you have had a very good attempt, and I think you covered a lot of the important areas, although it is more complex. And I think, yeah, as I said already, your history, yeah, it was not bad. I think maybe sometimes the structure can be changed a bit so you can follow along better with the time.
Okay.
Yeah, I think you tried to cover most of the social. There may be just small things that were missed, but generally good. With the management, you mentioned the relevant teams. I do think it would have been good to specify what some of them do more.
Okay. All right.
Yeah, so that's the only thing. I think maybe yeah, more on the endocrine, the yeah, so the gastro, as in being more specific, and social, like
Okay.
social services as well, would be good.
Okay.
Thank you, Shoppy.
Thank you. Thank you.
Okay, so we are now going to just have a quick discussion about your history as well as your discussion. First of all, let me start by complimenting you because you volunteered to do it. So that's always a good thing. So applause from me. Thank you. Secondly, unlike what you might have thought, I think you didn't do so badly. I think your history taking was a little bit here and there, but your examination, the last 9 minutes that you spent with the examiner was pretty okay. So in the examination, in the history, I would like you to sort of, uh, when you do it the next time, always give your proper designation. So you're saying I'm one of the doctors. It doesn't mean anything. Your scenario clearly mentions that you're a registrar in a DGH. So say what you are. And when you greet the person, always remember to ask, how would you like me to call you? Don't just assume that she would like to be called Janet. Okay. Also ask if there is anybody else that you would like to include in the conversation. So maybe dad is just outside the door and is waiting to come in, just waiting for your permission. Who knows? So do that. You did not address Junior at all. You didn't even ask me whether Junior is in the room. So that's another important thing. So when you are in the actual examination and history taking, usually the child is not there because these are role players. But just to be aware of your things, you need to know and you need to ask me, is the child in the room? Okay, so that's as far as the greetings and all that is concerned. Your basic discussion went okay because actually the role player was giving you very good information within the first 3 minutes. They summarized most of the problems, though not everything was enunciated or elicited properly. So, oh, they've left the room. Oh, they're there. Yeah. So yeah, so we need to kind of be certain what exactly are the problems here in the child. So when she said he's got holes in the heart, you could have asked, Mom, what do you mean holes in the heart? Or when she said he eats a lot, you need to probably have asked one or two sentences about his diet. So whether he has a healthy diet or whether he has a junk food or what kind of thing. So when she said Bangladesh, I think it would have been a good opportunity to determine whether they came from a big city or they came from a town or a village. That would have given you the kind of access to medical care properly. But in the in the actual process, you kind of did discover that he was on thyroxine, that he was on other things, which is good. I think the rest of the history was not so bad. You did cover as much as you could. I don't think we got the 4 minutes bell properly, so that's why I gave you 2 more minutes. And those 2 minutes probably were not enough. So I'm giving you the benefit of doubt that you would have asked about immunization and allergies if you had the proper time. But I want to ask you specifically, did you have those things written down on your paper that I want to ask about these things? Gerald, did you have all those things written on your paper that I have to ask about immunization and I have to ask about allergies? Was it written already? Gerald, please unmute yourself. Gerald, please unmute yourself. I think we have lost him.
Hi, I'm so sorry. My network is fluctuating. It's been dropping.
So tell me, did you actually have those points written on your paper that I have to ask about immunization and I have to ask about allergy? Or it completely
Yes,
slipped your mind?
yes, but I got caught by the time I put them down the list.
Good, good. As long as you've got them on the list, that's good. Then that was the thing that you could have told me when you started your time with the examiner. You said,
Okay.
I will examine the child, but you didn't actually say the words properly. So I will take a full history and I will do a full examination. I will look at his vitals. I will look at his anthropometric data, plot his height and weight on the appropriate growth charts. I will do his head circumference. There are special growth charts for Down syndrome patients, so that's something that you should have mentioned. Uh, I was a little bit annoyed by your answers for thyroid and a few other things. So that was definitely not correct. So I'm sorry to say that would have been a big problem for you to get the correct marks. So you never assess the thyroid hormones by looking at the weight or height or age of the child. You have to do the tests. So you would have said, if you had said that, having done the full examination, all you don't start assembling a multidisciplinary team until you have all the data. So that is a wrong approach. The clinical approach would be first history, full examination, then whatever necessary investigations are necessary, you need to get all the data in place before calling the endocrinologist. Otherwise, the endocrinologist say, haven't you done a TSH? Why are you calling me now? You see, that's what I mean. So your approach has to be systematic and logical. You can't call the endocrine team before you get the blood results back. Okay. In the same way, you mentioned about a developmental pediatrician. So I'll let you know that in the UK, developmental pediatricians are only involved in the first 5 years of life of the child, and the child comes after 5 years. They usually go under general pediatrician, and they are the ones who have to then refer back to all the other teams like physio and occupation and speech and language and all that. So you mentioned about school. Oh, Jared is again gone. Okay, there you are. So you mentioned about school, so that's okay. I hope you can hear me, but if you can't, then that's a shame. So yeah, so you need to liaise with the school. So you need to mention the word SENCO. So the special education needs coordinator is the person that you need to go to, and you need to write to them to let them know that you are now looking after this child, and that you will need them to organize the speech and language and physio and occupational therapy at the school. At the meantime, you'll also organize these in your hospital. So there is no harm in having two different kind of referrals going to the same people, because eventually there is a long waiting list for all these specialists in the UK. So the earlier you start, the better for you. In terms of the rest of the specialists, I have no questions about those. For the constipation, you don't need to involve the gastroenterologist at the first instance. So I think it was a little bit jumping the gun to ask for a gastroenterology opinion at this point. They're going to say, you know how to manage the constipation. Why are you calling us? So yeah, so we need to manage, we need to disimpact, we need to get his tummy back to a little better. A dietitian would be more important in the management of constipation. I don't know, you mentioned some ERIC website. What is that? Can't hear you. Okay, I think he's still struggling with his internet, so that's fine. We'll leave it for now. Okay, so that's my take on his presentations. How did you all find this discussion today? Was it useful? Please write in the WhatsApp group and give in your comments. So I am going to end by talking about my business plan. Is anybody among you interested at all in the acquiring of the videos? So if you want, you can purchase those videos for a very, very little price. If you want to do private tuitions with me, you can contact me. If you want to just go to the website drtahirkagalwala.com and purchase 1 month, 2 months, or 3 months subscription, you'll also get free classes in that. So have a look at all that. Okay. And anybody else wants to say something? Thank you, Dr. Adebola. But yeah, please put it in the WhatsApp group so that it encourages me. And yeah, thank you all for your time. It was great to have you all today. Bye-bye.
Thank you, sir.
Thank you.